everyone is good. And today we are going to discuss about some of the minor disorders which are commonly seen in neonates. First of all, we'll go through an introduction regarding these minor disorders. These minor disorders are very commonly seen in the neonates, and neglecting these problems, that is, health problems which are common in neonates, can be one of the factors which are contributing to the newborn mortality rate. Let me define these minor disorders which are seen in neonates. As we know, the minor ailments, which are usually a physical condition in which there is a disturbance in the normal functioning of the body. We'll be talking about some of the common neonatal disorders. In that, the first one I am going to talk about is the ophthalmia neonatal. As we talk about the ophthalmia, it is related to the eye, and neonatum is related to the neonates, right? So in the eyes of the neonates there will be any purulent discharge, or you can say that is the yellowish or it can be greenish discharge from the eyes of an infant within the 21 days of the life. This discharge, which is not normal, can be due to some of the chemical irritant while the baby is passed through the mother's canal, that is the vaginal canal, and it may be due to some of the bacterial infections, for example, the Staphylococcus aureus, or there can be, the presence of Escherichia coli. If we talk about the treatment of this condition, so depending on the result, how this discharge is severe, and according to the prescribed antibiotics, so antibiotic eye drops or some kind of ointments, for example, the erythromycin 0.5% ointment can be applied, which is commonly used, and it should be given every 6 hours. That too is for 7 to 10 days. So along with this, the prescribed medications, the eye care is very important to maintain the normal hygiene as well as to get rid of the infection easily. In that, the eyes or the eye single or the both eyes which are involved, they are cleaned with the sterile swab. That means a swab which is moistened with the normal saline, and then wipe with that cotton swab from inner canthus outwards. The second disorder which is commonly seen is the oral or the perineal thrush. So the word thrush which I used is actually a fungal infection which is caused by the Candida albicans, right? It's usually characterized by the white patches which are present over the mucous membrane of the mouth. It usually occurs during the time of the birth from maternal vaginal infection, or it can be after birth through the contact, through the, a person who is infected touching the baby. It can be easily transmitted to the baby. The perineal thrush, it may cause the soreness of the buttocks, and it is secondary to the oral thrush. What can be the treatment for this thrush? During the time of antenatal period, that means during the pregnancy time, the mother's infections, if at all it is present, then the candidiasis which is occurred or developed during the time of pregnancy should be treated before the delivery itself. Before or after the feed, clean the baby's mouth as well as the mother's nipple. The topical application of the nystatin or the amphotericin cream can be applied over the mouth or the presence where it is, especially over the buttocks. Then the miconazole suspension 3 times a day, at least for 4 to 5 days. The next disorder which comes as the skin infections, which is most commonly seen in the neonates. Most common or most usual infections which are seen in the neonates is the Staphylococcus or staphylococcal in origin. The things which are seen is like the septic spots are seen in a baby, that is the isolated pustules may be present over the skin of the baby, and it is resolved with the swab, that is the cotton wool swab which is soaked in the chlorhexidine 0.5% incipient. Then with the cleanse of that it may be resolved. The next thing under this skin infection can be the paronychia. That means the injury to the folds around the fingers, or it can be the toenails, which may result in infection. So for this also, in especially in the early stages, then the dabbing in the chlorhexidine 0.5% spirit again may be helpful. The next condition comes the omphalitis. It is the infection of the umbilicus, and it is suspected if there is any kind of inflammation present, or there can be the discharge or offensive smell from the umbilicus. So how this omphalitis is treated? First of all, the discharge from the umbilical region is to be sent for the culture purpose, and it is done to determine the organism present and to determine its sensitivity. On the basis of that report, then antibiotic administration or the antibiotic prescription is to be done. For example, the neomycin vistricin, a powder type which is applied over the umbilical area. The next disorder under these conditions come the neonatal mastitis. This mastitis, it is the enlargement of the breasts, but in case of the neonates, which is seen very rarely, but it is present at the time of the neonatal period. It is due to the effect of the maternal hormones. The treatment for this mastitis in the neonates is usually not required. But in case of any abscess formation or any kind of inflammation and infection, then the incision or the drainage is to be done to drain the pus from the breasts of the neonates along with the antibiotic therapy. Next most common condition under the neonates, it is the nasopharyngitis. It's actually an inflammatory attack of the pharynx as well as the nasal cavities that is causing the snuffles in the baby. If it spreads downwards to the respiratory tract, then the cry becomes more hoarse. In this case, the mother and the baby are to be singled out in a room. Then for the baby, the nasal spray is used to remove the congestion. Next common condition in the neonates comes the rhinitis. It's again an inflammation of the mucous membranes of the nose, which is usually caused by the staphylococcus. Nose and the throat swabs are taken for the culture purpose and sensitivity prior to the treatment. In this condition, the ephedrine nasal drops 0.25%. It is to be maintained to keep the nasal passage clear. Next condition we are going to talk about is the vomiting in the babies. As you know, the vomiting, it is the forcible ejection of the gastric contents. It can be seen in the babies due to the faulty feeding techniques. It can be seen as an result of the intestinal obstructions, or it can be due to some of the metabolic disorders. For this, the treatment we're going to talk about is, first of all, the cause of this vomiting is to be found, and accordingly the treatment is given. Proper feeding technique along with the feeding position is to be maintained during the feeds. Antiemetic medications and the fluid electrolyte balance are to be maintained too. The burp, which is more important after each feed, is to be done, or during the feed, a break of burp is to be done to prevent the child from the further vomiting. In case of any obstruction is found as a cause or as a responsible factor, then according to the medical advice, the surgery can be done. The one of the most common disorder, or the we can say a problem in the babies, which is seen as the excessive crying. So the neonates or the infants, they cry most often due to some of the number of reasons. Mostly we know the baby cries due to the hunger or due to the discomfort the baby feels. If there is the presence of intestinal colic, then the pain will be more and the baby will cry. In case of the insect bites, because we cannot communicate as we communicate with the adults, so we cannot be known to the reason behind the crying, but the cause can be due to the insect bites as well. Acute otitis media, which is very painful among the infants or the newborns, and it leads to the excessive crying. In case when the baby is having the retention of urine, when the baby is not able to pass the urine very easily, or it is not very frequent, then the baby may have the discomfort or the abdomen, and it may lead to the excessive crying. For this condition, the treatment is to be done. Frequently feed the baby, and according to the hunger of the baby or timing of the baby, feeding is to be maintained. Check frequently for the urine as well as the motion for the baby. The baby should be covered fully to prevent from the insect bites. And even after these all things or the preventions done, the baby, if not getting off this pain, then the child has to get a medical advice, which is necessary to find the exact cause behind the excessive crying. The next thing we are going to talk about is the abdominal distension. The children who are having the periodic abdominal distension along with the abdominal colic should be referred to the pediatrician. Some of the common causes may include regarding this: when there is the constipation with the ineffective peristalsis, if presence of the complications of the severe gastroenteritis. Intestinal obstruction can be the cause behind this abdominal distension, as the baby is not usually or commonly passing the stools by the time. Now we are going to talk about another common condition, that is the constipation, which is usually seen in the babies. When there is a prolonged straining or the forceful efforts of the children with passage of the hard evacuation of the stool. It may be due to the insufficient fluid intake or insufficient milk intake. This problem or this disorder is usually seen in case of the bottle fed children, as they do not get the exact nutrients from the milk. For this condition, the treatment can be: the doctors may prescribe some of the laxatives or the suppositories as well as the enema. For example, the milk of magnesia, which is a choice of drug. In case of the painful defecation or the pain around the anal area, the application of the lubricant is to be done. The next condition we are going to talk about is the pain which is seen in the children. As the pain is subject to its personnel and causes the sensation of the discomfort. This pain can be classified into three types. First thing is the peripheral pain. Pain may be superficial, it may be intermediate, or it can be deep. This peripheral pain, it arises from the skin, it arises from the internal organs as well as the muscles and the tendons. Next type comes the central pain. This pain arises from the central nervous system, or it may be induced by the trauma, or if there is obstruction in the circulation or any tumor. Then the next type of pain in the children is the psychological pain. The treatment for this condition can be: the mother's presence is very important with the children, especially at the time of the painful state. The mother's touch, the soothing words, as well as the cuddling, which provides a sense of security and love to babies. Then, along with all these things, the prescription of the analgesics and NSAIDs should be administered to relieve the pain according to the cause. In case of the peripheral pain, then the locally application of the lotions, that is soothing the pain. Then comes the hiccups and the sneezing, which is usually again a common disorder seen. These hiccups usually occur immediately after a feed due to the stomach distension and the irritation of the diaphragm, which may be due to the inhalation of the excessive gas during the feed, and the sneezing, which occurs due to the irritation to the nasal passage. For this, actually, the no treatment is required, but some of the things can be helpful. Take a break and work. That means while feeding, give a break to the baby and burp in between to relieve the gas which is inhaled during the feeds to remove the hiccups. One of the most common thing which is seen in the babies during the time of the neonatal period, it is the baby acne. This is caused due to the pregnancy hormones which stimulate the oil glands in the child. The treatment for the baby acne is the baby's face is to be washed normally with the warm water as well as with the mild baby soap. The baby's face is to be dried immediately and frequently, even after a wash or even after a feed. So while wrapping up the condition, we have talked about as the neonatal disorders, which are very common in this period. And in that, we came to know that these physical ailments or the physical conditions, right, which usually do not need any treatment, but in case of the negligence or in case of the bad consequences, then the treatment is necessary, right? And in this, the condition, for example, the infection to the eyes, which is a purulent discharge coming from the eyes, and for this the treatment is usually the cleansing of eyes or application of some of the antibacterial ointments which can be helpful to relieve from the infection. And in the same way, we have seen some other conditions, like, for example, the constipation in the babies, the vomiting, we have seen the excessive crying, as well as the pain and discomfort. So, all these disorders need the preventive measures as well as some of the care which will relieve these disorders. So, I'll be meeting you in the next session with the new topic. Till then, stay connected and stay safe. Thank you.